moving on to list maintenance then. Some people also may know that as list cleaning. Are you all right just to run through that with us, please, Ellie?
Yeah, so as part of PCSE's contract, we complete data quality checks on 5 cohorts that are nationally being recognised as having the highest discrepancy of inflated list size. So this is the comparison of the ONS data and improves to improve the GP practice list accuracy. So as you're probably aware, inflated GP practice lists impact global sum payments and is often due to the patient not informing you of updates to their registration. So the cohorts that we actually target are patients aged over 100, immigrant patients, multiple occupancy patients, so where 10 patients are registered at an address, student patients, and patients that live at demolished addresses. So currently, on instruction from NHS England, we're only completing immigrant patient cohort, which is completed monthly, and the over 100 cohort, which is completed biannually. The list maintenance process targets different cohorts in different ways, either by practice main contact only, the practice main contact and patient contact, or just patient contact alone. The immigrant patient cohort contacts the patient directly by a letter, and the NHS are trying an additional email being sent for these patients in recent months. Your patients may have made you aware that they've received an email from us. That's part of this trial. The over 100 cohort contacts the GP practice only, and it's only through the main contact via email. So,
yep, thanks, Ellie.
So patients may not be included in cohorts for several reasons. They may have been checked for the last 12 months, have changed their address, or been registered with a new GP in the last 12 months, so we don't include those patients. 3 out of the 5 cohorts include the practice being contacted first to confirm registration status. So responding to these will prevent FP69s being applied to your patient records. We request that practices ask patients to complete any action as well as practices to maintain and reduce the number of FP69 actions that you have to then go complete afterwards. When contacted, please don't alter the file name and ensure the file is saved in an Excel workbook. It means that we can use that data easily to submit into our system. We'll end up coming back to you for you to repeat the process. And also, responses to emails and letters by the patient and GP practice will reduce those FP69s, as I've said earlier, making sure that your patients you've answered any questions that they may have regarding letters or emails, and making sure they action them accordingly, but also making sure you action your FP69 so that those patients aren't deducted after the 6 months. I just want to flag that NHS England are reviewing this process, and the way that they do it may change in the coming months. At the moment, they are contacting the patients via email as well as post, which has been different to previous years. So yeah, please remind your patients to respond accordingly to the actions they've provided.